everyone. My name is Julie Bay and I'm a physical therapist assistant at Rehab Associates of Dresden and Newark. And we are on here today to talk to the public about minimizing injury and decreasing pain and so forth and muscle tightness that you might be experiencing. Obviously, with what's going on in our country right now, many of us are forced to be at home and doing increased activities around the house and perhaps outdoors. And we realize that with that increased activity, you can have some pain and tightness in the hips and low back. And we certainly want to get ahead of that, introduce you to some stretches and some mobility activities to reduce your risk of injury and pain. So I would like to show you a couple stretches and movements that you can do at home. Form and technique are extremely important, so I'm going to do them with you and you can feel free to join me. Just find a place where you can comfortably sit. You could have a kitchen chair, you could have the side of your couch or perhaps your bed, depending on the height. So this is a hip stretch. You're going to feel this one in the outer parts of your hip near your glutes and so forth. So what we're going to do, sitting out here towards the edge, my posture is always nice and tall. If you're able to, you're going to cross your foot over your knee. I realize some of us might not be quite flexible enough to do this, and if that be the case, I'm going to show you a modification. But you're crossing your foot over your knee. If you want a little bit more of a stretch, kind of slide this foot that's on the floor back. Notice I'm just right here, nice and tall, keeping my core engaged and my posture relaxed. Very important when you're stretching, you take nice deep breaths in and out. So while I have my foot up on my knee here, I'm going to take 5 slow, deep breaths. That helps facilitate the stretch and helps with relaxation. So just in and out, nice and deep, 5 times, okay? Obviously, you might be more tight on one side, but it's very important to do both sides. And you might see a difference between those two sides, and that's fine. That's very normal. We don't tend to have equal flexibility or strength on both sides. So again, my foot is up here. I'm up nice and tall. 5 slow, deep breaths, okay? And I'm not holding it that length right now, but that's something that you'll want to do. Take your time with these. If you find you're not quite that flexible and that's difficult for you, a way that you can modify that is just to slide your leg right up here on the bed. And some of you might look like this. That's okay. The more you do these stretches, the more those muscles will relax and you'll increase in your flexibility. So my leg is just right up here on the bed. Okay, same rule. My posture is tall, shoulders back. 5 slow, deep breaths. Just like so. Okay, again, I'm kind of going through it a little bit quicker than that, but you can do the 5 slow, deep breaths and then always on the other side. Okay, so holding it up here. Okay, 5 deep, slow breaths. Many of our patients ask us how many times should they do that. We always suggest, again, holding for 30 seconds or 5 slow deep breaths is about 30 seconds and doing each leg 3 times. Okay, that's a good general rule.